People with insomnia, however, have problems, right? It takes them longer to fall asleep, sometimes much longer than in this diagram, right? And then they're also waking up sometimes. Many are waking up in the middle of the night several times. And in this case, this person's falling asleep fairly quickly, but many people with insomnia have a long time going and take longer to go to sleep than this particular diagram might show. Well, in fact, if you have a diagram kind of like the lower one, if your sleep is like that, it may not feel to you like you're getting very much sleep at all. Why? Anybody give me an idea as to why it may feel like you're not sleeping at all?
Because you're awake. It looks like you're awake multiple times.
Right. And why would that make you feel like you haven't slept at all? Not to belabor the obvious. I'll tell you why. Because we are programmed not to be able to remember the moment at which we fall asleep. But we remember the instant at which we wake up, right? Think about it. When's the last time you remembered the time that you fell asleep? You just kind of drift into it. And your brain kind of erases that moment. We don't really know why, but it just kind of erases that moment where you fell asleep. So what happens is that you keep waking up, and you edit out the sleeping parts, and you string together the waking parts. And so you feel like you've been awake all night long. Many of my patients who have sleep studies will tell me, "Doc, I didn't sleep a wink." But I can show them on the diagram, and I can show them the picture where their eyes were closed. I can show them the video where they were sleeping. And it's because they have this issue of what we call sleep state misperception, where they don't really get the sense. So many people with insomnia feel like they're not getting very much sleep at all, when in actuality they're getting quite a bit of sleep. It's just kind of tortured, unhappy sleep. Okay? Fair enough. Now, the biological clock has some important other functions than just telling you when to sleep, right? It has other functions. So we're going to talk about a couple of them. It helps to regulate certain key hormones in the way they're secreted over the course of the day. Did you guys know that, for instance, cortisol is secreted at different levels over the course of the day? I don't know if this is something that's intuitive or not, but you guys know what cortisol is? Many of you probably do. Okay, so I'm going to back up and talk a little bit about cortisol. Cortisol is our main stress hormone. Okay, it's the hormone which helps us deal with stress more than any other. There are many stress hormones, but cortisol is sort of the grandfather of them all. Okay, it's the one that gets secreted when we go into a concentration camp at high levels. It's the one that helps us deal with deadlines. Okay, it's called a catabolic hormone, which is a fancy word for saying that it's a hormone that promotes turnover of tissue. It promotes tissue being used for practical purposes. Okay, it allows tissue to break down, you might say, in the interest of exerting effort and energy towards some kind of goal. All right, so it's a catabolic hormone that ends up causing your body to gradually break down. Yes. No, it's part of the system, but epinephrine is a fight or flight hormone. Adrenaline, okay, adrenaline is the primary fight or flight hormone. All right, so that's cortisol. And if you take a look, you'll see the yellow line in the middle shows cortisol levels, and this is a chart that shows 2 days in a row. Okay, 8 o'clock in the morning all the way to midnight, and then to 8, and then down over to midnight again. You can see how in the morning, the beginning of the white portion, cortisol levels are high in our bodies. Okay, and over the course of the day, they decline. Why? Because we need to have a lot of stress hormone present to be able to put up with the needs of the demands of daytime function. We're up and around, we're seeing people doing things, going places. We need to be, our tissue needs to be active, turning over, kind of, we're putting ourselves into use, okay? And by putting ourselves into use every day, our body breaks down a little bit. Inevitable, right? Just like, you're using some kind of a tool, a saw or something, right? Over the course of the day of using that saw, it's going to get dull, isn't it? Right? You can't avoid it. You use a knife, it's going to get dull over the course of the day. Our bodies get a little dulled down by the end of the day, okay? That's thanks to the activity of cortisol and other hormones that are related to stress, okay? But at nighttime, we need to rebuild, don't we? That's part of the purpose of sleep. We agreed on that, right? So the cortisol levels go down to their minimum level at the beginning of the night so that you would no longer be breaking your tissue down. And it sets the stage for another hormone called growth hormone to be secreted. Okay? Growth hormone is an anabolic hormone. Catabolic, anabolic. Anabolic hormones help your body rebuild and heal. Okay? So it only makes sense that growth hormone should be high during sleep when you're rebuilding, and cortisol should be low during sleep when you're rebuilding. There's kind of a nice poetry to it, you might say, right? It works pretty well, right, in normal cases. And melatonin, by the way, at the very top, is also a hormone. It is a hormone that helps regulate when you get sleepy. It's part of that sleepiness process, and you can see that the levels of melatonin start to rise long before nighttime, kind of in the afternoon, right? And that sends a signal to your body that you're going to be sleepy several hours later, not right away. That's why taking melatonin, some of you maybe have tried this medication, over-the-counter melatonin. If you take it right away, it rarely works very well. It tends to work better if you take it a couple of hours before bedtime because it takes a couple of hours for its effects to kick in. All right? Okay. Any questions so far? Yeah.
The chicken come before the egg. I mean, does cortisol promote activity, or does activity promote cortisol?
I don't know. I think that they kind of happen in parallel. Okay, and I'll show you in a second why I think that happens in parallel. I think that it just so happens that cortisol is produced to coordinate with the time that you're going to be active. But activity does help promote cortisol levels being high. They kind of supports the activity supports the cortisol levels being high, but it's not the determining factor. It's the biological clock that's determining when the cortisol levels are high. Okay? Yes?
Melatonin acts like speed when I take it.
Okay. So that's kind of an individualized issue. So we'll circle back around to that at the end because that's not pretty typical for most people. So some people have an unusual response to any kind of thing. Okay. All right. I want to show you this. We're not going to belabor this for too long, but I'm just going to point out that the black dots are a group of insomniacs, and the pink dots are a group of regular sleepers, people without insomnia. So you can see that the cortisol levels go down lower at night for people without insomnia. When you have insomnia, the stress of being up promotes the cortisol level not quite getting down as low as it would otherwise. That tells you that insomnia is stressful on the body, right? It's a state of stress, of elevated stress. I just want to show you that. All right. So let's pause. This is one of the questions I'm often asked. I'm tired. Does that always mean that I'm not sleeping well? So this is sort of a way of saying not all cases of fatigue are due to poor sleep. And not everybody in this room who has trouble sleeping is necessarily, or not everybody in this room who's tired is tired because they're not sleeping well, right? There are many, many causes of fatigue besides being sleepy. Autoimmune disorders, cancer, metabolic disorders, mitochondrial disorders, nutritional deficiencies, multiple sclerosis. The list is very, very long, right? However, there's a saying that they teach us in medical school, and that is, when you hear hoofbeats, think horses, not zebras, right? And that's because common things are common. MS is not very common. The sleep disorders are very common. And so if you're tired, it's always good to look at the sleep as the first play of the cards. And if nothing is found that's abnormal, well, then it's time to start looking under other stones. See what I'm saying? Okay.